going to talk about disorders of infant, children, and adolescents. Now, you will find that with infants and children, it is often difficult to find out whether they have any kind of emotional problems or not, and it is because especially with infants, their method of communication is by crying. So if they're hungry, they cry. If they need their needs met, they cry. So you can't really tell what kind of problem that infant is having. Okay, so the only way you can find out whether an infant or a child is having emotional problems is if their behavior demonstrates that they are having impairment in their activities of daily living, or if they're doing something that is not appropriate for their age. Those would be your cues to find out whether they're having any kind of emotional problems or not. Mental retardation is defined as deficits in general intellectual functioning and adaptive functioning. It falls under DSM-4 criteria number 2. So we already talked about the DSM-4 criteria, and I'm not going to go into depth, but you need to know that mental retardation falls under DSM-4 criteria number 2. With mental retardation, you want to look at general intellectual functioning, and that is your IQ test. So the higher your IQ is, the better your general intellectual functioning is. Adaptive functioning is your activities of daily living. So examples of that would be eating your own food, or feeding yourself, brushing your teeth, bathing yourself. So those are activities of daily living. That's adaptive functioning. So both of these things will tell us whether a kid is having any kind of problems with their mental ability. Predisposing factors to mental retardation, genetics is what accounts for 5% of the cases. Early alteration in embryonic development, that would be toxicity associated with maternal ingestion of alcohol or other drugs, maternal illnesses, and infection during pregnancy. Pregnancy and perinatal factors, those would be fetal malnutrition, viral or other infections during pregnancy, trauma or complication during delivery that deprive the infant of oxygen, or premature birth would be examples of perinatal factors. General medical conditions would be infections, let's say if they had meningitis, poisonings, such as lead poisoning, or physical traumas. Most of the time, physical traumas that cause the infant or the child to be deprived of oxygen. So most of your head injuries or hypoxia would be examples of those. Environment, again, nurturing has a lot to do with how the child grows up, and so deprivation of nurturance or social stimulation could predispose them to mental retardation. So you want to look into the environmental effects as well. Okay, when we look at the application of nursing process into the mental retardation, you want to assess two things. One is IQ and the other is the activity of daily living. Now with that, you can look at 4 different levels of mental retardation. Mild is where the child is capable of independent functioning but may need help at times of stress. With moderate, they can perform some activities but they may need supervision. With severe, these kids may be trained for elementary hygiene skills, but again, they need complete supervision. With profound mental retardation, these kids do not have any capacity at all. They require constant supervision, so it would be total client care with these kids. Okay, now when you're doing the assessment, you also want to look at family, because family is a very important part of the kid's life. So most of the time, these are the people that will take care of the client or your child. So you may want to look at the family members when you're planning and implementing care. Okay, some of the nursing diagnoses would be risk for injury, self-care deficit, impaired verbal communication, impaired social interaction, ineffective coping. When we look at outcomes, our outcome will be based on our nursing diagnosis. Examples of outcome would be that the client does not experience any kind of self-harm or physical harm. The client has their self-care needs fulfilled, or the client learns to interact with others in a socially appropriate manner. So those would be examples of outcome. Your plan or implementation, again, that would come from your outcome. So having a realistic expectation about clients' potential is very important when you're planning care for these kids. You want to find out methods for modifying behavior as required, and also you want to look into community resources from which they may seek assistance and support, and especially if you have a parent that does not have available resources. Community resources would be something to look into. Evaluation is the final process, so you're looking at whether your goal was met or not. Okay, let's talk about autistic disorder. With autistic disorder, you have a child that is very withdrawn into self. So this kid has his or her own world. Okay, so what happens is they have a marked abnormality in social interaction and communication. Now, these kids do not communicate, or they do not have any kind of social interaction. They do not maintain eye contact, and they would like to be left alone. Repetitive behavior such as hand flapping, head rolling, body rocking, eye poking, skin picking, hand biting, and head banging. Those are some things that you would see with kids that have autistic disorder. So what does that imply to you? Well, that implies that the kid is at high risk for self-injury. So your goal would be to prevent those kids from harming themselves. Autistic disorder, the prevalence, it is not very common, even though it is starting to get common nowadays. You would see that 9 in 1,000 kid would be having an autistic disorder. It is more common in boys than in girls. Biological factors, you can look at neurological implication, and what that means is abnormalities in brain structure or function. Physiological implication would be maternal medical conditions such as rubella. Genetics, we don't have to go over those, that's pretty simple. Perinatal influences would be maternal asthma or allergies. Okay, when you're assessing that child, you will see that they have impairment in social interaction, they cannot communicate, they have problems with repetitive behavior, so a lot of self-injury. Okay, when you look at diagnosis, that would be risk for harm would be something to look into. Impaired social interaction, impaired verbal communications are some other example. Now, I'm not going to go over the nursing process, which I would think that you would need to know what the nursing process is once you find out what is the problem with your client, and then when you look at the nursing diagnosis. So these are all in your textbook. Okay, so what I want to focus on is medication. Okay, so when we look at medications, these are the two medications that have been approved by the FDA, which is your Respadol and your Abilify. So these are both antipsychotic medications, and most of the time, why would someone get this medication? It is basically if they are aggressive, if they show a lot of self-harming behaviors, temper tantrums, quickly changing moods. Those would be reasons why your client would be getting those antipsychotics. With a child, you want to be careful about the dosage, because there's not a specific dose that will be given. You have to take into consideration the weight of the child when you're giving this medication. So again, the dosage is based on the weight of the child and the clinical response. Now, we want to look at some common side effects of resveratrol, and those are drowsiness, increased appetite, fatigue, constipation, drooling, dizziness, and weight gain. And weight gain is a very, very common complaint that you will hear from the clients that are taking these medications. Common side effects of Abilify, you want to look at sedation, fatigue, vomiting, tremors, and weight gain. So if you look at both of these medications, weight gain, drowsiness are some common side effects. Okay, let's talk about ADHD. Now, with these kids, either they have problems with their attention span, they cannot be attentive, or they're very hyperactive and impulsive. So either or, they have problems, and it is more frequent than you would see in kids of their same age. Okay, and these are the subtypes. With the combined type, you would see that they have problems with both inattentiveness and with hyperactivity. With the others, it is pretty obvious. With predominantly inattentive type, you would see that these kids have problems with attention span, and with the predominantly hyperactive, these kids are the ones that are very hyperactive. So that is very self-explanatory. Predisposing factors, genes, again, we talked about genetics, so I'm not going to go over that. Biochemical theory, you want to look at dopamine, norepinephrine, and serotonin. Those are the neurotransmitters that could predispose a child to ADHD. With prenatal and postnatal factors, if you had a mom that smoked during pregnancy or was drinking alcohol, those could be issues that could lead to ADHD. Environment has influence as far as whether a kid could be predisposed to ADHD and not. And especially with lead, you would see that if they were someone who had lead poisoning, then they could be predisposed to ADHD. Psychosocial influences, if the child had a disruptive family, or if the family was a low socioeconomic family, then you would see that they have more problems with ADHD. With assessment, what you would see is that these kids have problem performing their age-appropriate task. They are highly distractible, so they cannot pay attention, and they have extremely limited attention span. So either they will be very hyperactive, or even if they are able to pay attention, it will not last for a very long period of time. So they may be doing multiple things and forget about certain things. So these could be your kid that do not do their assignments as they have been directed in school. Okay, so they may be doing incomplete assignments. Comorbidity. Now, one of the things that you will find out is a lot of kids that have ADHD also have other disorders. Okay, so they may be having conduct disorders or learning disorders, anxiety, substance abuse disorders. So they don't just come with ADHD. Most of the time they have another disorder as well. What could be some good examples of nursing diagnosis as far as the kids with ADHD? Risk for injury, impaired social interaction, low self-esteem, and non-compliance. So those are examples. And with the nursing process, I'm not going to go over all of them because you should be able to apply that by now. Planning implementation, there is a question that talks about a person that has ADHD and is having difficulty maintaining concentration in inpatient milieu. So what would you do to help that client with ADHD? The answer is C, because they have a shorter attention span. You would encourage them to divide the task into smaller attainable steps. Okay, so dividing the task would help those clients. Okay, let's look at the medications for ADHD, and what you would have is CNS stimulants. Now, you will notice that most of these end in AMINE. So, some of the examples are dextroamphetamine, methamphetamine, dexmethylphenidate, and that is Ritalin. So these are different medications. Now you want to pay attention to how they end, which is most of the time they end in AMINE. So that would help you learn these medications a little bit more easier. Okay, as far as side effects with CNS stimulants, since these are things that stimulate, you would kind of guess that insomnia would be one of the side effects. Anorexia, weight loss, tachycardia, and also decrease in the rate of growth and development is a very important side effect to keep in mind. Okay, let's talk about Strattera. Now that medication is a selective norepinephrine reuptake inhibitor. You want to make sure that you monitor the cardiovascular and liver functioning when you're giving this medication. Also, you'll find out that the psychiatric symptom may actually be worse, so then compliance may be an issue. So you may want to educate your client and let the family know that the symptoms may actually worsen before they start to get better. Now, some of the side effects are headache, nausea, vomiting, decreased appetite, dry mouth, weight loss, insomnia, and increased blood pressure and heart rate with Strattera. Okay, Wellbutrin is another medication, and we have already talked about Wellbutrin. If you remember, this is one of our antidepressants. Now, with Wellbutrin, the side effects are anorexia, weight loss, dizziness, tachycardia, nausea, and constipation. Now, also insomnia is a side effect of Wellbutrin, and you want to make sure that if insomnia is a side effect, you want to give that last dose of medication at least 6 hours before bedtime. Because if you give it too close to bedtime, then they may actually not sleep the whole time. Also, you want to be very cautious when you're giving this medication to anyone that is having seizure and eating disorders, because this medication can actually cause seizures, and it also decreases appetite. So you want to be very cautious about who you're giving this medication to, which is a potential side effect from the prolonged use of Ritalin. This is again a CNS stimulant, so you want to make sure when I talked about Ritalin or CNS stimulants, I told you to remember that it causes a decrease in the rate of the growth and development. So that is the answer. Okay, conduct disorders. These are kids that have problem with, basically they violate the basic rights of other people, and also they violate the rules. So you will see that there's two different types of conduct disorder. One is childhood onset type. If it occurs before age 10, then that is childhood onset. Otherwise, it is adolescence onset. Okay, predisposing factors, we can look at genes, temperament, and biochemical factors. Biochemical, you want to look at the neurotransmitters norepinephrine and serotonin, because those would be ones that would predispose you to having conduct disorders. Okay, the other things, you also want to look at psychosocial influences and peer relationship. Most of the time, these kids are very aggressive, so they are not able to form a very, very good peer relationship, and because they cannot form a healthy relationship with their peers, they may have more aggression. So it is like a cycle. Family, if there is a family that has a lot of parental rejection, inconsistent management with harsh discipline, early institutional living, or frequent shifting of a parental figure, those would be things to look at as far as what could predispose someone to conduct disorders. Okay, with assessment, you'll find that these kids are very aggressive, okay, and they will violate other people's right. These kids may be someone who may be found stealing or lying, and that's very common. They may have low academic achievement, they may not be able to control their anger, they may have problems with hyperactivity or impulsiveness. Now, one of the thing that distinguishes conduct disorder is that these kids are not guilty of what they do, or they do not have any feelings of remorse. So not feeling guilty even though they're doing things that are violating the rights of others is the characteristics of this disorder. Okay, some of the nursing diagnoses are risk for other directed violence, impaired social interaction, defensive coping, and low self-esteem. So you can look at those. Now, as far as the nursing process, I am not going to go over the nursing process. That should be in your book, so you can look over outcomes, planning, and evaluation. Okay, here's a question. Conduct disorder may be a precursor to the diagnosis of which personality disorder? The answer is B. It is antisocial personality disorder. Oppositional defiant disorder, this is where there is a lot of negativistic, defiant, disobedient, and hostile behavior towards authority figures. So we all may not agree with what our parents tell us to do, but with these kids you'd see that this disobedience is more frequently than you would see in people or kids of their same age or at that same level. Okay, so when you look at family influences, these are people that their parents may have problem in disciplining, structuring, and limit setting. Okay, so parental problems in disciplining, structuring, and limit setting could cause someone to have oppositional defiant disorder. Also, parental unavailability, so the parents not being available when the kids want them to be there, could predispose them. The assessment of these kids would tell you that they have a lot of passive aggressive behavior. So they may be very stubborn, disobedient, negative. They may test their limits a lot. They may be resistant to directions. They want to avoid school, and they may not want to listen to what other people want to say about them. Now, the problem with these kids is they do not see that they are being oppositional or they're being defiant. They view that the problem is arising from other people because they're making unreasonable demands, but not because they are being oppositional. So there's a difference. Some of the nursing diagnoses are non-compliance, defensive coping, low self-esteem, and impaired social interaction. So you can look at those. And I'm not going to go over the nursing process. Like I said, you can look that up in your book. Tourate's disorder, this is where the child has presence of multiple motor tics or one or more vocal tics. Now, this is more common in boys than in girls. Now, you may want to know what tics are. Tics are sudden, repetitive motor movement that involves discrete muscle groups. So you will see that they have sudden repetitive movement whenever they have a Tourate's disorder. Some of the predisposing factors are, again, biological factors, genetics, neurotransmitters. Environment also has an effect as far as predisposing a child to Tourate's disorder. So lead poisoning would be an example of that. Application of the nursing process. When you assess these kids, you'll see that they have tics that may involve the head, torso, or their upper and lower limbs. The sign may actually begin with a single motor tic, most commonly eye blinking, and then they could have multiple other symptoms. Diagnosis is risk for self-directed or other directed violence, impaired social interaction, low self-esteem. So you may want to look at those nursing diagnoses. Outcomes planning, evaluation, again, you can look at your textbook for those. As far as medications, there are actually two different classes of medications. Okay, one is your antipsychotic, and then the other one is alpha agonist. So to help these clients, they would get these medications. Now with Taurus, they would normally not want to give you any medications if at all possible. They would want to give you other forms of therapy such as behavioral therapy, individual counseling, psychotherapy, or family therapy. But sometimes they may also give you medications to help, but it is very rare that they get these medications. Okay, with antipsychotics, these are your Haldol, Respadol, Zyprexa, and Zeodon. So you may want to look into these medication. Alpha agonist is your clonidine and Tinex. So these are the two different class of medications that you will see in kids that have Tourette disorder. Okay, so these are mostly to control the symptoms. Separation anxiety disorders, that is if a child has excessive anxiety separating from home or from those to whom they are very attached. Okay, now we all have some form of separation anxiety disorder, but these people have excessive anxiety. Predisposing factors are biological influences, environmental influences, and family influences. I want to talk about family influences. Now, these are kids that have possible over-attachment to their moms. They may have separation conflicts between the parent and the child. Maybe parental overprotection is a concern. Application of the nursing process. Now, as far as assessment, you will see that these kids have difficulty separating from their mother, so they may have symptoms such as crying, tantrums, screaming, and clinging behaviors. If it is an adolescence, you'll see that they are very reluctant, or they may refuse to attend school. They may have specific phobias as well if they have separation anxiety disorder. Anxiety is something that you will see in almost all of these age group if they have separation anxiety disorder. Okay, what are some nursing diagnoses? Anxiety, ineffective coping, impaired social interactions are examples of some nursing diagnoses. Again, you can look into the nursing process. Finally, some of the things that you can do for these clients, which we already talked about some of the behavior therapy in our previous class, so I'm not going to go and into a whole lot detail about behavioral therapy, but this is something that would definitely help someone with separation anxiety disorder. You can also look into family therapy, group therapy, and psychopharmacology. Now, as far as psychopharmacology, those would be your anti-anxiety medications. So, for example, your benzodiazepine or any other anti-anxiety medications would help with help clients that have separation anxiety disorders. So this is all about the disorders of infant, child, and adolescents. So I expect you to go over these. The PowerPoint is also posted on D2L, and you can use your textbook for more reference.